Hey everyone, welcome back to our Diabtron channel. Today we're diving into an important health topic that affects millions of people worldwide, prediabetes. If you or someone you know has heard about prediabetes but isn't quite sure what it is, you're in the right place. Stick around as we unravel the mysteries of prediabetes and explore what you need to know to make informed decisions about your health. First things first, what exactly is prediabetes? Prediabetes is a health condition where blood sugar levels are higher than normal, but haven't reached the threshold for a type 2 diabetes diagnosis. It's a critical warning sign that your body is struggling to regulate glucose effectively. Before we go any further, let's take a look at some eye-opening statistics. Did you know that approximately 88 million adults in the United States alone have prediabetes? That's a staggering number, and the global figures are equally concerning. The prevalence of prediabetes highlights the importance of understanding this condition and taking proactive steps to address it. Now let's talk about the factors that increase your risk of developing prediabetes. Several factors can increase the risk of developing prediabetes. It's important to note that having one or more of these risk factors doesn't guarantee that an individual will develop prediabetes, but they may contribute to an increased likelihood. Here are some common risk factors. Age. The risk of prediabetes increases with age, especially after 45 years old. Family history. If you have a parent or sibling with diabetes, your risk of developing prediabetes may be higher. Weight. Being overweight or obese is a significant risk factor. Excess body fat, particularly around the abdomen, can affect the body's ability to use insulin effectively. Physical inactivity. Lack of regular physical activity is associated with an increased risk of prediabetes. Exercise helps control weight and improves insulin sensitivity. Dietary habits. A diet high in processed foods, refined carbohydrates, and added sugars can contribute to weight gain and insulin resistance, increasing the risk of prediabetes. Race and ethnicity. Certain racial and ethnic groups, including African Americans, Hispanic, Latino Americans, Native Americans, and Asian Americans, may have a higher predisposition to developing prediabetes. Gestational diabetes. Women who had gestational diabetes during pregnancy are at an increased risk of developing prediabetes. Polycystic ovary syndrome, PCOS. Women with PCOS, a hormonal disorder common among women of reproductive age, have an increased risk of insulin resistance and prediabetes. High blood pressure, hypertension. Having hypertension is often linked to an increased risk of prediabetes. Low HDL cholesterol and high triglycerides. Abnormal cholesterol levels can be associated with insulin resistance and an elevated risk of prediabetes. Sleep disorders. Conditions such as sleep apnea may contribute to insulin resistance, potentially increasing the risk of prediabetes. So, how is prediabetes diagnosed? Prediabetes is typically diagnosed through blood tests that measure blood sugar levels. The American Diabetes Association, ADA, recommends the following tests for diagnosing prediabetes. Fasting blood sugar test, FBS, procedure. This test is conducted after an overnight fast. You won't eat or drink anything except water for at least 8 hours before the test. Results: a fasting blood sugar level between 100 and 125 milligrams per deciliter, mg/dl, is indicative of prediabetes. Oral glucose tolerance test, OGTT. Procedure: after an overnight fast, your blood sugar is measured. Then you consume a sugary solution, and your blood sugar is tested again after 2 hours. Results: a blood sugar level between 140 and 199 mg/dl 2 hours after the sugary drink suggests prediabetes. Hemoglobin A1C test procedure. This test measures the average blood sugar level over the past 2 to 3 months. It doesn't require fasting. Results: an A1C level between 5.7% and 6.4% is indicative of prediabetes. Prediabetes itself does not typically cause symptoms, but it is a significant warning sign that the body is struggling to regulate blood sugar levels properly. If left unaddressed, prediabetes can lead to several complications, including type 2 diabetes, Without lifestyle changes, prediabetes can progress to type 2 diabetes. Elevated blood sugar levels can eventually overwhelm the body's ability to produce enough insulin or use insulin effectively. Cardiovascular issues. People with prediabetes have a higher risk of developing cardiovascular diseases, including heart disease and stroke. Elevated blood sugar levels can contribute to the buildup of plaques in the arteries, leading to atherosclerosis. High blood pressure. Prediabetes is associated with an increased risk of hypertension, high blood pressure, which further raises the risk of heart disease and stroke. Kidney damage. Long-term elevated blood sugar levels can contribute to kidney damage. This may eventually lead to chronic kidney disease. Nerve damage. Neuropathy. Prolonged exposure to high blood sugar levels can cause nerve damage, resulting in symptoms such as tingling, numbness, or pain in the hands and feet. Vision problems. Diabetes, including prediabetes, can increase the risk of eye complications, including diabetic retinopathy, which can lead to vision loss if not managed. Sleep apnea. There is an association between prediabetes and an increased risk of sleep apnea, a condition where breathing repeatedly stops and starts during sleep. Alzheimer's disease. Some studies suggest a link between insulin resistance, a hallmark of prediabetes, and an increased risk of developing Alzheimer's disease and other forms of dementia. Lifestyle changes play a crucial role in managing prediabetes and reducing the risk of progression to type 2 diabetes. Healthy eating. Focus on a well-balanced diet that includes a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats. Limit the intake of refined carbohydrates, sugary beverages, and processed foods. Pay attention to portion sizes to help control calorie intake. Regular physical activity. Aim for at least 150 minutes of moderate intensity aerobic exercise, e.g., brisk walking per week, or 75 minutes of vigorous intensity exercise. Include strength training exercises at least 2 days per week. Find activities you enjoy to make exercise a sustainable part of your routine. Weight management. Achieve and maintain a healthy weight. Losing even a small amount of weight, such as 5–10% of your body weight, can have significant health benefits. Focus on gradual, sustainable weight loss through a combination of a healthy diet and regular physical activity. Quit smoking. If you smoke, consider quitting. Smoking is a significant risk factor for cardiovascular diseases, and individuals with prediabetes are already at an increased risk. Limit alcohol intake. If you choose to drink alcohol, do so in moderation. This generally means up to 1 drink per day for women and up to 2 drinks per day for men. Regular monitoring. Work closely with healthcare professionals to monitor blood sugar levels regularly. This may involve periodic tests to assess your progress. Stress management. Practice stress-reducing techniques such as meditation, deep breathing, yoga, or other activities that help you relax. Chronic stress can contribute to unhealthy lifestyle habits, so managing stress is an essential component of overall health. Adequate sleep. Aim for 7 to 9 hours of quality sleep each night. Poor sleep can affect insulin sensitivity and may contribute to weight gain. Regular medical checkups. Schedule regular checkups with healthcare professionals to assess your overall health and receive guidance on managing prediabetes. And there you have it, folks. We hope today's video shed some light on the important topic of prediabetes. If you found this information helpful or informative, give us a thumbs up and hit that subscribe button below. Don't forget to click the notification bell so you never miss out on our latest content. If you have any questions, comments, or topics you'd like us to cover in future videos, drop them in the comment section down below. Your feedback is invaluable to us. Stay informed, stay healthy, and remember, taking small steps today can lead to big changes tomorrow. Thanks for joining us, and we'll catch you in the next video.